Great day. So let me start by welcoming Fiona Carragher. Fiona is the Deputy Chief Scientific Officer of NHS England. We've created an enormous step for a little person to jump up, so all look the other way. While gazelle-like, she leaps to the stage. You're going to give us an overview of national policy.
I am actually. Where's the... Oh, there we go. So, good morning, everybody. And yes, barely 5 foot in very large heels. So, I'm thinking of doing what my 2-year-old would do, which is to jump off at the end, because it's a really good step. So, fantastic to see you all here today. It's been an absolute pleasure to work with so many of you on what has been quite a challenging year, but actually today that we're going to celebrate our next steps. So we're here to celebrate the WHO World Hearing Day that really starts off explaining it's about a sound investment. And I think in England we can be really proud of ourselves to making some really large steps forward in this. And in some ways, I always feel that I don't need to tell this audience, but I think that we really should start off to explain that hearing loss affects so many of us in our population. And all of us will know somebody who's either got hearing loss or has been affected, or we've worked with somebody. We know that it affects about 1 in 6 of our population, but we're expecting that number to grow over the next few years as our population ages. And many of those people will have complex needs and have comorbidities. So we need to be thinking differently about how we provide not only our health, but also our other services around them. We know as well with hearing loss that it has a really quite dramatic effect both on the physical and mental health and the impact on that of the individual, but actually on their ability to be independent, to go through the school system and then to go through into employment. So one message that I know I've given quite strongly over the last year, that although I'm standing up here from NHS England, this is not just about health. This is not just about the impact on health. This is about a much broader societal impact. But we do know, and I think we have to be honest here, that there's significant variation in the access to and the quality of the service and support that's currently offered to the patients and the group that we support. And we know we've got key significant issues in clinical services. The person-centred approach is not always utilised, but we have some fantastic examples of where it is, and we need to learn from that and to share those good examples. We know also that there's silo working between clinical teams, and we don't just see this in hearing, we see this across many, many care pathways, that we work to our professional silos and our different departments. But we also know that there's significant issues in terms of workforce, in terms of the education and training that we need for services fit for the future. Now, I stood up in front of many of you just over a year ago and said, if we're going to do something for the action plan on hearing loss, I think we need to take away the one key word in that, and that's about action. And I challenged all our partners just over a year ago to say, we're going to do this. We're going to write a commissioning framework. We're going to get that evidence together, gather what we know good looks like so that we can support our local commissioning groups. And we're going to do it in what was a really challenging timescale. So within 6 months, we'd brought all the evidence together, and many of you were with us at the launch of the commissioning framework in June, July last year. But we didn't stop there. And what was really clear from the work that we'd done with our partners in the first half of last year was that there was a huge amount of energy, enthusiasm, passion to make change happen. There was real action there. So in some ways, I was a bit cheeky, but I came back and said, so what can we do next? What can we do? We can't just sit down and say, well, we've done the commissioning framework and that's that. We set up task and finish groups across the key areas of the action plan on hearing loss, around prevention, around earlier diagnosis, around living well, and around research and innovation. And it's been fantastic to work with those key partners, because those task and finish groups were chaired by colleagues who are here today from the different sectors. And this was absolutely done in a co-produced way. This was all of us working together. And I think what's been shown is that we can really achieve great things when we do work together, when we work in partnership, when we bring our skills, our experience, our expertise together, when we challenge each other. And we've all challenged each other, I think, over the last year to make sure that we're putting our patients and our populations at the heart of what we do. So my first thing is to say, this is a really great example internationally about mobilising, working together, working in partnership and making change happen. And that's where we're here today, to celebrate, to look at the launch of our next things. And you're going to hear from colleagues who've worked really, really hard over the last 6 months to bring the next set of deliverables to you. You're going to have at the back some tangible stuff to take away in your hands, not only to show the work that we've done, but actually to take away and use your networks, use your colleagues. You are the champions of the action plan on hearing loss. And again, I know colleagues of you have heard me say this. If it stays in the Elephant and Castle, if it stays in Skipton House, we've missed the point. This is about all of you going out and championing what's happened and what we can do by working together. So I'm going to leave it there. You're going to hear from me at the end, but I'm going to pass back to Viv for the next steps.
Fantastic, thank you. Jump. Ray. Okay.